If you've ever wondered what are the symptoms of diabetes, then stay tuned because this video is for you. Diabetes is a chronic medical condition characterized by high blood sugar levels. There are two main types of diabetes, type 1 and type 2. Here are common symptoms associated with both types. Common symptoms of diabetes, type 1 and type 2. Frequent urination, polyuria. People with diabetes often experience an increased need to urinate, especially at night. This is because the kidneys work to eliminate excess sugar in the bloodstream through urine. Excessive thirst, polydipsia. Increased urination can lead to dehydration, causing excessive thirst. People with diabetes may find themselves drinking more fluids than usual. Extreme hunger, polyphagia. Despite eating more, individuals with diabetes may still feel constantly hungry. This is because the body's cells are not getting the necessary energy from glucose due to insulin problems. Unexplained weight loss. Even with increased hunger and food intake, unexplained weight loss can occur in diabetes, particularly in type 1 diabetes. This is because the body is unable to properly utilize glucose for energy. Blurred vision. Elevated blood sugar levels can affect the lens in the eye, causing temporary changes in vision. Blurred vision is a common symptom. Frequent infections. High blood sugar levels can weaken the immune system, making individuals with diabetes more susceptible to infections, especially yeast, thrush, and urinary tract infections. Fatigue. High blood sugar levels can lead to fatigue and a general sense of tiredness. This is because the body's cells are not receiving the energy they need. Slow healing of wounds. Diabetes can impair the body's ability to heal. Cuts and sores may take longer to heal or may become infected more easily. Additional symptoms in type 1 diabetes. Sudden onset. Type 1 diabetes often develops rapidly, and symptoms can appear suddenly, sometimes within a few weeks. Ketoacidosis. In severe cases of untreated type 1 diabetes, a condition called diabetic ketoacidosis, DICA, can occur. Symptoms include nausea, vomiting, abdominal pain, and a distinctive fruity breath odor. Additional symptoms in type 2 diabetes. Gradual onset. Type 2 diabetes typically develops more slowly, and some people may not experience obvious symptoms for years. Tingling or numbness. High blood sugar levels can damage nerves over time, leading to a tingling sensation or numbness, particularly in the hands and feet, diabetic neuropathy. Skin changes. Dark patches of skin, often in the armpits or neck, can develop in some individuals with type 2 diabetes, a condition called acanthosis nigricans. Overall, it's important to note that not everyone with diabetes will experience all of these symptoms, and some may not notice any symptoms at all, especially in the early stages. If you suspect you have diabetes or experience any of these symptoms, it's essential to seek medical advice and get a proper diagnosis and treatment plan. Early detection and management can help prevent complications associated with diabetes. Frequently asked questions section. What are the most common symptoms of diabetes? The most common symptoms of diabetes include frequent urination, excessive thirst, extreme hunger, unexplained weight loss, fatigue, blurred vision, slow wound healing, and frequent infections. Are the symptoms of type 1 and type 2 diabetes the same? Many symptoms are similar between type 1 and type 2 diabetes, such as frequent urination and excessive thirst. However, type 1 diabetes often has a more sudden onset, and individuals may experience symptoms like diabetic ketoacidosis, DICA, in severe cases. Type 2 diabetes symptoms may develop more gradually. Can diabetes cause vision problems? Yes, diabetes can affect vision. Elevated blood sugar levels can lead to temporary changes in vision, causing blurred vision. Over time, diabetes can also increase the risk of more severe eye conditions, such as diabetic retinopathy. Why do people with diabetes experience frequent urination and thirst? High blood sugar levels and diabetes lead to increased glucose in the urine. To eliminate this excess sugar, the kidneys work harder, resulting in increased urination. Frequent urination can lead to dehydration, causing excessive thirst. What is diabetic neuropathy? Diabetic neuropathy is a condition in which high blood sugar levels damage nerves, often resulting in symptoms like tingling or numbness, particularly in the hands and feet. It can also lead to pain and problems with coordination. What is diabetic ketoacidosis, DKA? DKA is a severe complication of diabetes, most commonly associated with type 1 diabetes. It occurs when the body doesn't have enough insulin, leading to the breakdown of fat for energy. This produces acidic compounds called ketones, which can lead to symptoms like nausea, vomiting, abdominal pain, and fruity breath odor. Are there any skin changes associated with diabetes? Yes. Some people with type 2 diabetes may develop dark patches of skin, often in the armpits or neck. This condition is known as acanthosis nigricans and is a possible symptom of insulin resistance. Can you have diabetes without experiencing symptoms? Yes. It's possible to have diabetes without noticeable symptoms, particularly in the early stages. This is why regular screenings and checkups are essential, especially if you have risk factors like a family history of diabetes or being overweight. What should I do if I suspect I have diabetes or experience these symptoms? If you suspect you have diabetes or experience symptoms like frequent urination, excessive thirst, or unexplained weight loss, it's important to consult a healthcare professional. They can perform tests to diagnose diabetes and develop a treatment plan if necessary. Can diabetes symptoms be managed or alleviated with lifestyle changes? Yes. Lifestyle changes such as adopting a balanced diet, regular exercise, and maintaining a healthy weight can help manage diabetes symptoms and improve overall well-being. In some cases, these changes can even help prevent or delay the onset of diabetes.